Chronic wounds, defined as wounds that fail to progress through the normal stages of healing within an expected timeframe, present a significant clinical challenge and burden on healthcare systems worldwide. Unlike acute wounds, which typically heal within weeks, chronic wounds, such as diabetic foot ulcers, venous leg ulcers, and pressure ulcers, can persist for months or even years. Understanding the underlying mechanisms that contribute to impaired healing is critical for developing effective treatments. The pathophysiology of chronic wounds is multifactorial. A key feature is a prolonged inflammatory phase characterized by excessive infiltration of neutrophils and macrophages, leading to persistent production of pro-inflammatory cytokines and proteases. This hostile microenvironment degrades growth factors and extracellular matrix components essential for tissue repair. Additionally, chronic wounds often exhibit impaired angiogenesis, reduced cellular proliferation and migration, and senescence of resident cells such as fibroblasts and keratinocytes. Factors such as hypoxia, repeated trauma, infection, and underlying comorbidities, diabetes mellitus, vascular disease, further exacerbate the problem. Biofilm formation by pathogenic bacteria is another major obstacle in chronic wound healing. Biofilms protect microorganisms from host immune responses and increase resistance to antibiotics, perpetuating inflammation and tissue damage. Moreover, dysregulated matrix metalloproteinase (MMP) activity leads to excessive breakdown of the extracellular matrix, preventing proper wound closure. Current treatment strategies for chronic wounds are multifaceted. Standard care includes regular wound debridement, infection control, moisture balance, and offloading pressure from the wound site. Advanced therapies aim to address specific deficits in the wound environment. These include the use of bioengineered skin substitutes, growth factor therapies such as platelet-derived growth factor, negative pressure wound therapy, and hyperbaric oxygen therapy. Recent advances in regenerative medicine have introduced stem cell-based therapies and gene editing approaches designed to enhance cellular function and promote tissue regeneration. Emerging research is focusing on novel interventions, such as targeting biofilm formation with antimicrobial peptides, modulating the immune response to resolve chronic inflammation, and using nanotechnology to deliver therapeutic agents directly to the wound bed. Personalized medicine approaches, leveraging genetic and molecular profiling of wounds, hold promise for tailoring interventions to individual patients. Despite these advances, chronic wound management remains complex, and recurrence rates are high. Ongoing research into the molecular and cellular mechanisms of chronic wound pathology is essential for the development of more effective, targeted therapies that can improve healing outcomes and quality of life for affected individuals.